Numbers are mixed up.
Good afternoon, ladies and gentlemen. I'd like to call the November 19th, 2024 meeting of the Mecklenburg County Health and Human Services Committee to order. Thank you all for being here. We have an extraordinary topic today that our Deputy County Manager will help lead us off. But welcome to those who are also joining us via our Zoom, and we are ready to have a wonderful, wonderful meeting. So let me start off, ladies and gentlemen, by introducing the committee. Then we will go to the staff members and any guests other than those that are presenting. So I will start from my left. If you will introduce yourself, Commissioner.
My name is Vilma D. Leak, and I represent the most powerful district in the county, and that's District 2. And I was re-elected with big numbers.
All right, thank you, Commissioner Leak. I'll go to my right.
Good afternoon. I'm Laura Meyer, and I represent District 5.
We have a continuing co-partner in the committee. I'd like for her to introduce herself, please.
Thank you, Mr. Chairman. Susan Rodriguez McDowell, elected by the people of District 6.
Thank you. And I'm Arthur Griffin, County Commissioner at Large, chairing the Health and Human Services Committee today.
Highest number of votes.
Let me go to our Deputy County Manager to introduce himself and those around the table, and then we'll get our guests shortly.
Well, first, Commissioner Powell sent me a message, says she's on her way up, so she'll be up here shortly. And I am Anthony Trotman, Deputy County Manager.
Thank you.
Good afternoon, Stacy Lowry, Director of Community Support Services.
Good afternoon, Kim Henderson, Director, Child, Family, and Adult Services.
Good afternoon, Taya Cruz, Assistant to Deputy County Manager.
Good afternoon, Yolanda Griffin, Director for Department of Community Resources.
We have some visitors or guests behind you. If you will share the mic.
Good afternoon, Allison Nelson, Senior Health Manager with the Office of Chronic Disease Policy and Prevention in the Public Health.
Good afternoon, Mamie Saki Harris, Food Security Program Manager with the Office of Chronic Disease Policy and Prevention in Public Health. Thank you.
Good afternoon. My name is Tina Postel, and I'm the CEO of Nourish Up, formerly known as Loaves and Fishes Friendship Trays, with our new Hunger Hub in District 2, but there's not a district in Mecklenburg County that we do not feed people.
Good afternoon, Zach Wyatt with Carolina Farm Trust.
Jack Sheehan with Assist Me, a nonprofit providing medical equipment to low-income residents.
Good afternoon, I'm Abby Wyatt, the Livable MEC Manager in the County Manager's Office with Health and Human Services.
Good afternoon, Kay Tembo, Community Relations Coordinator with Public Information.
Good afternoon, Kimberly Scott, Assistant Health Director for Population Health with the Public Health Department.
Good afternoon, Derek Wilson, Food Access Coordinator on Food Security Team, the Office of Chronic Disease Policy Prevention of Mecklenburg County Public Health.
Good afternoon, Chris McCullough, Alliance Health Community Impact Specialist.
All righty. Seems like we have everyone today, and we will wait until we get our wonderful commissioner to join us. But I'm going to call on the committee members while Commissioner Powell is on the way. If we could approve our minutes from the October 15th meeting.
Second.
All right, there's a motion and a second. Any discussion? Hearing none, all those in favor of approval of the minutes of the October 15th meeting, please say aye.
Aye.
Pose same sign. Hearing none, motion's passed. Commissioner Powell will be here shortly, but we're going to go ahead and turn to Deputy County Manager to at least introduce this topic. And by the time the presenter gets up, Commissioner Powell should be here, and we will pause and give Commissioner Powell a chance to introduce herself. All right, thank you.
Well, Commissioners, this is a topic of food security updates that we have been working on for maybe 2 years now. Several years ago, the board made this one of your priorities as you all put $3 million in the budget to attract a grocery store on the west side. Since then, there's been lots of discussions about many different food policy initiatives going on in our community, but we wanted to do a level set and do some research so that you can understand the ecosystem of food security issues in our community. And that's what our public health team is going to present today.
Sounds like a winner. Before the presenter takes the podium, we've been joined by our other committee member and would like for Commissioner Powell to introduce herself.
Good afternoon. Mecklenburg County Commissioner Elaine Powell. I represent District 1, which is all of North Mecklenburg. Good to see everyone. Thank you.
Thank you, Commissioner Powell. Mr. Trotman? Yes. I guess Dr. Scott?
Dr. Scott, yes.
Welcome, Dr. Scott.
Thank you. Good afternoon, everyone.
Good afternoon.
Thank you to the committee, the chair of this committee, all members, staff for the opportunity to present before you today. I am representing the Public Health Department, and we intend to provide some updates not only on the programs and initiatives that our food security team currently leads, but we wanted to also take a step back, as mentioned by Deputy County Manager Trotman, to talk a little bit about some of our efforts to try to improve our internal infrastructure for data and evaluation of our investments so that we can have a better sense of what we are doing in the food security space from the public health perspective and where we intend to head in the future, rooted in evidence and data. So what we intend today is to start with just a brief overview of some of the work happening on the public health side. I'm so glad to have several of my colleagues here today representing the Public Health Department and our food security work. I'm led by Allison Nelson, who leads our chronic disease policy and prevention team, and specifically Mamie Saki Harris, who is the manager for our food security initiatives. So without further ado, I'm going to turn it over to Mamie to start and kick off the presentation to give a brief summary of some of the work that her team is leading, and then we'll take a deeper dive into discussions about our improved data systems that we're continuing to build upon with hopes that we'll have some stronger internal practices in place to understand the food ecosystem and make improvements moving forward from a public health perspective. So at this time, I'll turn it over to Mamie and revisit you at the mic after we give an overview of our food security programs.
Thanks very much, Dr. Scott. And good afternoon, Chairman Griffin, Commissioners, Health and Human Services Committee members.
Can you speak louder, please?
Oh, yes, definitely. I said, good afternoon, Chairman Griffin, Commissioners, Health and Human Services Committee members, Deputy County Manager Anthony Trotman and all. My name, as Dr. Scott mentioned, is Mamie Saki Harris. I'm the Food Security Program Manager. The work I'll be presenting is a result of collaborative effort from a very dynamic team that I'm humbled to lead, and the success of their work is in turn based on strong inter and intra-departmental collaborations, in addition to strong community partnerships that undergird much of the work. As mentioned by Dr. Scott, I'll give a brief overview of our public health food security programs, beginning with a brief framing of core issues and a high-level overview of background of what we have done to date and our strategy, plan, and future initiatives. This can be more easily summed up in where we were, what we have done, and where we are going. I will then hand over to Dr. Scott for a more robust review of our most recent assessment. Food and nutritional security remains a significant challenge in Mecklenburg County, with significant numbers of our population having inequitable access to affordable, healthy, nutritious foods to maintain a healthy and active lifestyle. Contributing factors include economic disparities, which is a physical and economic access to healthy foods, including barriers to food distribution. There's also no current for local, consistent, real-time data, and these are some of the efforts that we really want to address when we speak about this. I'll give a brief overview of some of the backgrounds of what has brought us to date now. We have had a few assessments on food security. We have a State of the Plate assessment, which began in 2010. And the next one was in 2015, and the most recent has been the 2019 to 23 assessment. Because of COVID, they couldn't do a regular assessment. The key findings for this particular survey was on the need for increased access to healthy,
Speak in
affordable
the mic,
foods.
please, baby.
Oh, sorry.
Lady, I'm sorry.
That's fine. Thank you. I keep forgetting about that. But anyways, as I mentioned, this is just a brief background of some of the assessments that have been done to date. State of the Plate began in 2010. It's supposed to be done every 5 years. It was not done in 2020 as a result of the pandemic. And instead, they did a consulted 2019-2023 effort, which looked at what the impacts of the pandemic was. And as we know, that had exacerbated food insecurity. The key highlight of this State of the Plate shows an inequitable access to food and poor transportation access systems for many of our Mecklenburg County residents. Current Carp and Partners is a 2018 study, and that study was looking at the food security situation in Mecklenburg County and the surrounding region. What that study showed was health inequities, disparities within our health systems, and the need for more affordable, equitable systems to healthy foods. It is based on these research programs, especially the 2018 Current Carp and Partner study, that we did quite a few food security assessments, the goal of which was to address the information that was highlighted in the surveys to date. I've highlighted here a few of the assessments that we've done, and all of these lead into our action plan, which is part of our community health improvement plan and also leads into the SCOTCH. Studies that have surveys and programs that I've highlighted here, it's not an exhaustive list, but it actually points to some very aggressive programs that we've done within our food security landscape. Our Edible Landscapes program, as a result, has 50 bills. The 50th was done last Saturday. We have built over 1,000 fruit trees and bushes have been planted within our communities. About 500 raised garden beds have been established. Most of these programs are done in our public health priority areas. Farmers markets, 75% of our farmers markets now receive SNAP double-up bags. And of these that receive SNAP double-up bags, we have also, just this year alone, included SNAP double-up bags at the Charlotte Regional Market with efforts from our community members. Primary is the Charlotte Mecklenburg Food Policy Council. Our Healthy Corner Stores initiative has refrigeration in there. And we've also started to have digital coupons in these corner stores. We have collaborative efforts across the county with Outteach, other organizations that address K-1 to 12 in Title VI schools, where we are looking at expanding access to healthy foods with our Senior Nutrition Farmers Market program, food as prescription in some of our hospitals, Atrium, Novant, and we are looking at exploring a system within our county system, Healthy Eating Communications campaign through our CDC REACH grant efforts, and also food security assessments, of which Dr. Scott will go into more detail. Many of these programs have been implemented to enable us address those core aspects of equitable access to food. This doesn't even mention the work that the county has also done with the Carolina Farm Trust addressing.
Mamie,
Yes.
I just need you to slow down a little bit. You're going so fast and the commissioners are trying to write and take notes. So I just need you to just slow down and just a little bit.
Thank
okay?
you. Thank you. I will. I speak
Thank
a little fast, so
Thank you.
I will slow down. But yes, as I mentioned, the core highlights of these programs, I won't go back into them, but I think the underlying goal is we have done quite a bit of work, thanks to the funding from the Board of County Commissioners, to do this aggressive work in our community, some of our partners of which are here as well. The what's next? As we've done this work, what has come to light for us is the importance of having robust systems for which we can access and understand our food security context. We do not want to be reactive. We want to be proactive, understanding where we are going with our food security context, and putting systems in place that can help us predict and also analyze what is happening within our food security system. Right now, we do not have those systems in place. We want to start by understanding what is our local and current context. Once we have an understanding of that, we want to be able to understand what is the scope and breadth of our nutritional and food insecurity in the county. We're not just talking about food insecurity. You'll notice here we have nutritional insecurity because we know food is not enough. We need to ensure that our community members have equitable access to nutritious, affordable food within their local systems. And understanding what those gaps are and understanding how we can do that in culturally acceptable ways is primary to what we are trying to do here in food security. Finally, we would like to ensure that with the information gained, we can have investments, programming, and advocacy that highlights partner alignment and enables us to address those critical needs that we have identified from our community partners in collaboration with them as we understand what those pertinent food needs are within our society. An opportunity exists for us to improve access to timely and local data that would enable us to ensure practical understanding of our food security system. We are looking at doing this in a phased approach, and I'll show a brief slide which gives some details on that, and then Dr. Scott will go into what we have done in phase 1. This graphic over here seeks to work you through what our plan is, a high-level plan on addressing food security. We wanted to start with a geospatial analysis, understanding using Google API and innovative AI techniques. What does our landscape look like? The bird's eye view of Mecklenburg County. This work has been done, and you have in front of you an executive summary of the findings from this geospatial analysis. This is just the start. This gives us an insight, a snapshot of what the county looks like. It talks about accessibility, affordability, availability of food, and it looks at nutrition and food security indicators. It highlights key gaps that we see within our county, and it also highlights key aspects for which we can start to address these gaps. One thing it does not do is speak to our community members to really understand, is what we're seeing the same as what is on ground? And that's what the next steps will help us do. Phase 2, that's going to be looking at trends and predictive modeling. We'd like to understand what is the definition of food insecurity within our community. We have our definitions. Is this consistent with our community? We also would like to understand, where are we seeing those gaps? Does this align with the data we have? Do we need to find new data? How can this data be reliable? How can it give us the ability to predict and be able to have proactive ways of addressing food security? What data dashboards can we put in place? There are not too many counties that have these information available, and we would like to be one of the first that can be a template or a pilot for other counties to assimilate. And we don't see why we cannot do this in this great county of Mecklenburg County. Surveys and assessments is going to be phase 3. We have already identified partners who can assist us with that. We would like to have an understanding, once we've done those trends and predictive modeling databases, what surveys and assessments need to be done, how we collaborate with our academic institutions to have assessments that give us a clear understanding of our local context. For now, we base our data largely on information that just doesn't give us granular data, but just large bird's eye view information of the Mecklenburg County food security situation. And then finally, in phase 4, we like to ensure we can implement monitoring and evaluation practices that can keep us constantly understanding, innovating, and addressing the gaps that we see. At this point, I want to pause and hand over to Dr. Scott, who will walk you through the assessments we have just completed for phase 1. That's the geospatial mapping for food security in Mecklenburg County. Thank you very much.
Thank you.
Thank you, Mamie, for that introduction. So just to take a deeper dive and talk a little bit more about what our plans are for this assessment. As mentioned, we are trying to build a stronger infrastructure so that we can have access to real-time data when possible, and stronger evaluation practices to understand the scope of our investments as a public health department, to understand the work that our partners are doing within this space, to make evidence-informed decisions. So this assessment, again, is 3 phases that includes not only publicly available data, but a series of surveys, qualitative data, hearing the stories of people in community, and just taking advantage of the technology that's available to us to understand trends that are happening within our community. We know that our community is growing quickly. We know that our community is diversifying. So making sure that we can predict trends and understand where we need to place future investments. So this current slide that you see just shows the cover of that assessment that Mamie referenced, which is a part of phase 1 of the project. And this project was conducted in partnership with Metabolic Institute, which is a global firm that does a significant amount of work within the food security space, sustainability, and environmental spaces. So we were pleased to work with them to explore how we could leverage some of the Google technologies to do some advanced mapping of just publicly available data to understand what's happening in community. So we'll talk a little bit more about that in future slides. This is, again, the preliminary first phase of the report, and this final draft is hot off the presses as it was just finished this month. So we're happy to present this information to you. And we've already talked about some of the core pieces. Some of the methodology within this particular report also focuses on walkability and how accessible people can walk to food retailers or other locations to access food. There's a methodology that focuses on just transportation analysis and also just gives some overall access reviews that we'll talk about a little further. So as mentioned, here are the 3 core elements that the report is broken into. Again, this uses Google Analytics and mapping. So looking at maps of the community to understand where things are physically placed and how it might impact our residents and their ability to access. So availability, affordability, and accessibility are the 3 core elements in which the following slides are broken up into. So when we think about availability, this first portion really focuses on food businesses within the community, and just doing a manual count and inventory of how many food businesses we have within the community. I'd like to preface by saying this is point in time when the data was reviewed by our team members at Metabolic, and it's using publicly available Google data. So per the initial inventory, there are roughly 4,387 food businesses within Mecklenburg County. And of those, 898 are food retailers. So when we think about retailers, that may include our grocery stores. It may include convenience stores that sell food products. It may include dollar stores that have grocery components. This is a breakdown of who's included in food retailers for this particular count. The second figure focuses on food away from home, which is primarily restaurants. So in the manual count included in this report, 3,489 food away from home locations were identified. So within the assessment, there was a deeper dive to look at all of these establishments to determine healthy offerings and affordability for these particular retailers. This next map, I know the colors might be a little challenging to see, focuses on the retailer component. So if you look at the map, it's by census block, which when we think about census blocks is more granular. So thinking about neighborhoods. This particular map shows food retailers by census blocks. The green dots represent those locations that are considered to have healthy offerings. The red dots are those that are retailers that are considered to have mostly unhealthy offerings. And then the yellow section, which is very few on this map and very difficult to see, are those that are listed as uncertain. And that might be because there wasn't enough data available to assess the offerings within that location. So if you look at this particular map, roughly 66% of all the census blocks within the county have no food retailer that's offering healthy food options. And that can be depicted by the sea of red that's pictured in this particular map. You can also see that a sea of red is concentrated centrally to the city. We see more pockets of green in some of our more affluent areas throughout the community, and some sprinklings throughout what we would consider the uptown area where we see some concentrations and pockets of green. The other thing to consider with this particular map is that it also considers the food retailer density. So within each census block, if the particular block is a darker shade of blue, that means that block has a higher concentration of retailers within that particular area. So you can see there's several areas with light blue, but then there's some areas with no color at all, representing no access to those retailers in those spaces. One other point to consider that is not depicted on the map clearly is that the assessment revealed that Mecklenburg County does have a growing concentration of what's considered healthy ethnic retail stores and independent grocers that are really clustered on the eastern part of the county. And that is also a source of expanding access to food retail within those regions of the county. This next map focuses on food away from home. So again, largely focused on those restaurants. And the same color code exists for this particular depiction. The red represents those that have unhealthy offerings. The green represents those with healthy offerings, and the yellow, neutral, or more to be discussed or reviewed in those particular areas. So you'll see we have, again, a large proportion of red dots that are focused on the restaurant offerings, with some of the concentrations, particularly surrounding malls and those retail areas where you see heavy concentrations of red. But primarily just you see the unhealthy spread throughout the county within those retailers and restaurants. If you look at the healthier restaurant options, they tend to be clustered around the city center and some of the suburban areas of the county, including the southwest portion of the county in Davidson. So transitioning into affordability. Again, this particular assessment focused on just publicly available resources through Google. So I'm sure many of you have Googled a restaurant and you may see a ranking that has a number of dollar signs associated with the restaurant, where it classifies the affordability of a restaurant by dollar sign. Some of that same technology was used to assess the restaurants that are within the community, to understand pricing and affordability for food that's served within those particular restaurants. This particular data, or the points that are listed on this slide, I'll show you in the following slide, a visual breakdown to further describe this, but roughly half of the affordable and moderate food retailers are either they have a healthy or neutral or unhealthy offering, and then the expensive food retailers all offer some healthy option. And I think that's probably on par with what we've experienced in convening at some of these facilities. The more expensive the food, the more healthy offerings you tend to have on the menu. The least expensive the food, the fewer healthy options that you tend to see on the menu. So this particular graphic depicts what we just described here. So the first part focuses on retailers, including some of our grocery stores and those other spaces that might sell food. So again, the more expensive options you see have more access to healthy food options, and those that might be considered affordable or moderate have less healthy food options. When we look at our food away from home or restaurants, you can see the more expensive the restaurants are, the more healthy options that are available. But still, even within that space, only 13.2% are considered to have healthy options on those menus. Again, the neutral options have also include those restaurants where we might not have a full access to menu data, in addition to offerings that are provided by those restaurants. But when we look at unhealthy offerings under food away from home, we see that most of our affordable restaurants, 67.9%, offer unhealthy options. Transitioning to accessibility. Accessibility really focuses on the transportation element and how people are able to connect to food. And it looks at 4 core modalities of transport, including cycling by bicycle, public transportation, walking or driving. And also there was some analysis done looking at e-scooters since that's a growing mode of transportation within community. So when we look at cycling, about 96% of residents can reach a healthy retailer within 10 minutes by bike. But when we look at our infrastructure, only 2.5% of residents really live in areas where they can bike to these areas. When considering public transportation, in most cases explored through this particular assessment, there was no real benefit to traveling via public transportation just due to inconsistencies with route times and things of that nature to support people to access those healthy food retailers that might be of interest. When we look at walking, roughly 4% of residents can walk to a grocery store within 5 minutes, and less than half of all residents can walk within roughly 15 minutes. When considering driving, over 99% of our residents can reach a healthy food retailer by car or e-scooter within 10 minutes, and over 84% in 5 minutes if they have access to a car or scooter. So this next map shows a depiction of accessibility to grocery stores by walking within 5 and 10 minutes. The dark purple color shows locations that, well, firstly, let me take a step back and say the red dots represent healthy food retailers within the county. The dark purple represents areas that people can walk within 5 minutes to access those particular retailers. The lighter purple represents areas where people can walk within 10 minutes. So this shows just an overall bird's eye view of the county being able to walk to a grocery store in up to 10 minutes. If you live outside of those areas, the likelihood of being able to walk to a location is very low. The next slides, we'd like to talk a little bit more about identifying low-income, low-access food areas. For the first portion of the discussion, we'll talk a little bit about the USDA and the current methodology they use to describe low-income, low-access food areas. Some of these maps are commonly described as food desert maps when you review this information on publicly available websites. This particular methodology focuses on the total population within a census tract. So we talked a little bit about block groups, which are smaller, more granular neighborhood. Census tracts are a little larger than those block groups. So these counts really focus on the total population within those areas and looking at the percent of the tract population that might be under $30,000 or the poverty threshold compared to whether or not a median family has an income that doesn't exceed 80% of the median family income. When thinking about additional opportunities to explore what potential risk might be in place when thinking about our growing populations and trends and changes within community demographics, we thought it was important to also not only look at the USDA methodology, which is a common methodology to understand or get a start to understanding what food insecurity might look like from the food desert perspective, but also we thought it was important to try to start thinking about predictive modeling techniques to explore opportunities for potential risk in the future. And for that reason, we engaged with Metabolic to explore an expanded definition of what food insecurity might look like based on low-income, low-access areas using a more granular definition. So this definition focuses on not the total population within a census tract, but the proportion of households that are within some of those smaller neighborhoods that might be deemed as low income that don't have access to affordable or nutritious food options. In comparison to the USDA methodology, this methodology looks at family poverty threshold level of less than $35,000 for a family of 4 as compared to $30,000 for the USDA benchmark. So we'll talk a little bit more. We have some visuals to help explain this, but just wanted to set the tone and provide some foundation as to why we wanted to explore different methodologies to understand, again, as Mamie kind of mentioned before, where we are, but where we're going and why we might need to expand some of our definitions to understand how our community is growing and changing. So using the USDA definition, this first map depicts some of those low-income, low-access food areas. So based on this particular methodology, Roughly just under 90,000 households are estimated to live in low-income, low-access areas. And the darker the red in the map, that shows that those areas have higher households, higher numbers of households that are considered food deserts. So you'll see there's a concentration within what's typically referred to as the crescent for food deserts within the county. Of that roughly 90,000, about 54,949 of those households are more than a mile away from the closest food retailer. And of that 89,764, about 24,000 of those households are living under the poverty threshold. There are some limitations to this methodology. There's no perfect methodology for determining what's considered low income, low access areas. But again, it's a start to hopefully start to understand what's happening within community. This next slide depicts metabolic, what we're considering at-risk households. Again, expanding that definition of poverty, expanding it to roughly 35,000 to look at smaller block groups versus census tracts. And again, if you recall from the earlier discussion, the total population was considered in the USDA calculation, whereas in this particular calculation, it's focused on the proportion of those who might be considered low income within these particular areas. So if you look at this particular map, you'll see that these are particular areas that we might need to focus on that might have hidden pockets of food insecurity within our community that aren't depicted in the USDA methodology. So those areas that are darker represent the number of low-income households that, you know, could be potential food deserts based on the metabolic methodology. So when we look at this particular data, roughly 56 of the 624 block groups contained no households living in food deserts. Then roughly 53,000 low-income households, or about 12%, were considered to be in food deserts. Next, roughly 22,568 low-income households live in block groups where more than 99% of the households are further than a mile from a healthy food retailer. Again, there's no perfect methodology for understanding the breadth and scope of food insecurity within the community, but we wanted to offer a couple of different approaches as to how we currently understand what's happening within the community and potential areas to explore based on shifts and trends within the community. So there were a few recommendations that were compiled as a result of phase 1 of this particular mapping-centered assessment, one including investing in integrated policy approaches for nutritional security, aligning bus networks to major food retail. I think it was really evident in some of the data presented on modalities used for travel that busing was often viewed as challenging for accessing current food retailers available within the community. Other recommendations focused on urban planning and zoning to make healthy food and affordable food more accessible. Exploring new levers to allow low-income residents to access healthy foods, and then further investigating our food deserts and those hidden households suffering from food insecurity, as highlighted on the second slide for the metabolic methodology, which highlights some of those areas that might be hidden pockets for low-income households that might experience food insecurity. Again, I'd like to reiterate that this is phase 1 of our work. We are compiling, trying to compile a comprehensive system of data, including not only the work that we do as a public health department, but also working with our partners to understand what types of data they're collecting and reviewing to assess and evaluate food security within the community. So having said that, I'd like to transition into a view of a supplemental component to this report that was conducted where we focused on an internal food security ecosystem inventory. And this particular inventory focuses on current investments that either public health or some of our partners within the Health and Human Services umbrella are currently connected to through either vendor agreements, community grant partners, our ARPA investments that are related to food security. We wanted to map out and centralize and inventory that information in one place to understand what investments have been made to date, what the scope of the work is, and how all of these partners might be working across our HHS enterprise, because oftentimes partners might work with different departments to address different food security needs. So the next couple of slides, I'll show you a really brief demo of the tool that's been put together to assess some of that partner mapping to supplement this particular report. So just to give you a little bit of additional detail about the process, we convened some of our internal stakeholders within the food security space within the county. So our peers from public health, our DSS teams, and other peers throughout the county, environmental sustainability, who have been doing work within this space. We engaged to one, just start the inventory process to understand what particular programs and services we might be engaging with and how our partners might be connected to our peers within these spaces. To show you an example, we created this particular system, which is it's a system called Kumu, and I'm going to try to do a live demo, so hopefully it will work. So basically, this system has mapped out core investments. I know it's very difficult to see because we have several investments within the food security space. Some of our core investments by department and team. I'll give you an example here. We have our public health department that's listed here. And this particular, the lines are connected to all of the partners we work with in the food security space, be it partners who were awarded funding through ARPA, be it partners who we engage for our community grants program, partners who we engage with the farmers market. They're all displayed on this particular map. The interesting thing about this is we can start to see some of the intersectionality across departments and teams within our HHS bubble. So for example, this particular tool has an intense inventory of all of the services and reach and location that these particular vendors or partners have to execute food security work. So one of our core partners, Rosa Parks Farmers Market. It's a farmers market that the public health team has invested in and supported over the years. This particular farmers market, if you click on the farmers market, it shows a profile of that partner, including the community connection level. There's an actual inventory that describes what that means. So is this a farmers market? Is this a food retailer? Is this a food business? What does this include? There's a ranking based on what type of organization it is. There's also a description of the fiscal year in which financial investments may have been made from the county perspective and whether or not internal funding sources or external funding sources were used. There's then information on location, which we can use to map the particular partners that we've invested in, where we can in the future do some overlays and compare some of the maps used in the assessment to where our partners are working to see where there might be opportunities. So for every single dot that you see represented or partner logo, there is a profile that looks like this within the system where you can see how we're working with different partners across the enterprise. This again is limited to Health and Human Services and some of our core partners who have a food security agenda embedded within their work. We collected this information through surveys and group meetings and discussions to compile an inventory and embed it within this system. This system will be publicly available so that you all can explore and see what those investments look like. But again, using Rosa Parks as an example, if I can scroll back up, it shows not only a profile of what's happening within that particular organization, but it shows dotted lines to how we are connected across the enterprise. So for interest of time, with Rosa Parks, there is connection to work happening with SNAP Double Bucks, which is also connected more broadly to our Health and Human Services work. So again, we hope to share this information with you so that you can review and see what our investments look like. It includes anything from grassroots organizations to some of our larger contracted partners who are engaging with our teams. And this is just a screenshot to show an example of that particular tool. So our next steps, we really hope to share this inventory. We're hopeful that it can be a tool to better understand, again, some of our internal investments within this space and how Our public health team is connected to partners within the food security work, who are doing food security work. And this, again, will be available publicly post-meeting. We then intend to move into phase 2 of the food security analysis, which will include more primary data collection, surveying to understand in larger depth the scope of food insecurity within the community. And then after we continue to build upon this framework to develop an assessment, we hope to establish a dynamic tool where we can input all of this information to inform decision-making regarding food security. And at this time, I will pause to see if there are any questions and invite my colleagues to join me as well for questions regarding the presentation.
Well, thank you so much, Dr. Scott and team for your presentation. I will just make a comment, then I'll go to my colleagues. We do 3-minute rounds. Let me just say to our Deputy County Manager, if you want anything to say before we go into our questions. I will. No.
Thank you.
All right. Just an observation. This is like a graduate course in food insecurity. Half of this stuff, I have no idea what you're saying.
Exactly.
But it's important information. It's a lot of data, and I tried to understand it by reaching out to get some of these documents, like State of the Plate. Taya sent me all of those reports. I read every one of those, and I'm even more confused. In terms of where we are as a county. I'm sort of simple. You guys have heard me before. What's the problem? You know, what's the intervention? What's the results of that intervention? And as I shared with Dr. Washington the other day, I got something from the Duke Endowment on one of our scorecards for food insecurity is percent and number of food insecure households or residents. And the concept is that there's a number there or a figure there or a percent there. And then next year, that percent either goes up or down in terms of what the impact of our intervention has been. So I'm sort of trying to figure out how to get my arms around the county's investment. And did we reduce food insecurity because of that investment for one family or one household or two households, et cetera? And in reading, committee members, bear with me for a minute, just want to quote something. One of these State of the Plate things said a whole lot, but one piece got my attention. It says, I used to work for a nonprofit organization where we partner with Organization X. And I kept writing referrals for the same families over and over and over again because nobody was talking to them. Okay, what is your financial situation that's causing you to always have to come back to the pantry to get food for your family? What exactly is going on? Those questions are not being asked. This was in your 2023 final report of State of the Plate. And so what I'm, as one person of 9, I'm interested in is, you know, what's the problem? What's the intervention? And did we fix something for some people? And if we could get to that point, it would be helpful. A lot of things you threw out on slide number, whatever it is 4. Last retreat, they talked about double bucks. And when I did the numbers, only 1% of our SNAP households participated in double bucks when Dr. Allen made a presentation. So whereas we have a lot of things, gardens, fruit stands, fruit trees, digital coupons, what I was looking for is what was the results of those for a family or a household? That gives me some sense of accomplishment as a commissioner. And maybe it might be that we need to, as a policy, the commissioners can sort of identify populations that we can fix, so to speak, to a degree, not fix, but fix in terms of food insecurity. Maybe it's the elderly, maybe it's the infirm, maybe it's this, I don't know that. But we'll have to be guided as a county commission as to what that population looks like. But right now, it's kind of wild west in terms of food insecurity. Because you can be in a household of 100,000. If you mismanage your money, you could be food insecure. So I'm kind of like, who are we fixing out there, and how well are we fixing it? And the words I get from the state and from you guys is something called results-based accountability. And the questions is, how much did we do? How well did we do? And who's better off because of what we did would be my position. But colleagues, I apologize for starting off, but it's a lot of information. It's a lot of great information in terms of statistics and perspectives. But I was really trying to figure out how, as a county commission, we can fix some households, because we have a capacity with other nonprofits to do financial management, to do, job placement, to figure out about transportation, but to try to fix the whole county is, I think, more philosophical. But colleagues, let me go from right to left. I'll start with Laura Meyer, Commissioner Powell, then Leak. We'll do 3-minute rounds, and then we'll go back to our guest commissioner over there, Commissioner Rodriguez McDowell. So Commissioner Meyer.
All right, thank you, Mr. Chair. And thank you for this very thorough presentation. Just some real quick questions at the beginning on slides 3 and 4. So state of the plate, the last one was 2019 to 2023. Is there another one planned soon? I would think.
They would like to plan another one, but there's no clarity right now on what that would look like.
Okay. And then on page 4, slide 4, these initiatives happened after that state of the plate 2019 to 2023. Is that right?
Some of the initiatives started before then.
Okay. And then, okay, so we're still, so on number, sorry, on number 7, this was the process, correct? From the mapping all the way to the evaluation. That's the process. And these are what we've done already, correct? And we're still pretty much in phase 4.
We're in phase 1.
Okay, so everything that we just went through.
It's phase 1.
That's just phase 1.
It's phase 1. So just for clarity, Commissioner Griffin mentioned the need to identify the problem, solutions, and evaluate. The purpose of today was to help identify what the problem is and to try to reduce some of the data that we have to show what the problem is within our community through data. So phase 1 is really focused on that information gathering to just depict what the problem is within community. Simultaneously, our work is still occurring. As referenced here, we have several initiatives that are happening and occurring. So we continue to evaluate those initiatives as well. But we're also simultaneously looking at having a better understanding of what the problem is and how we move forward with future investments that are rooted in evidence.
Okay, there's just is a lot of data, which is great. And I guess that's my confusion because we're already doing so much now, which it's just a lot of overlap.
If I could really quickly, so the intention, good afternoon, everybody. The intention here is to talk about sort of how we help drive our decision-making on a go-forward basis. So as you all know, there are a number of initiatives in Health and Human Services and the Health Department that provide food support to people. There are programs, the senior programs, we have SNAP, we have WIC as well. some of which are long-term programs, some of which are short-term, some are locally invested, some are state, some are federal, depending on the mix. As you guys talked at your last meeting, there will come a time where we won't be able to keep investing in things. And we'll need to be able to make informed decisions about, one, where is the highest priority for the problem? Because we can't just say it's the entire crescent or, and we have some tools now that are a little bit more nimble, like the mobile markets that can go to smaller areas where we won't have the money to build a grocery store, for example, and we might be able to target our efforts more specifically to those areas. But we've got to have data to understand what that is. We can't just say, hey, Commissioner Meyer heard there was a food problem on this side of town or in this neighborhood. So this is to help us have some foundational information to drive how we make those decisions in the future. As Dr. Scott mentioned, we also have to evaluate what programs are working and which ones are not. That's not the point of today's conversation. We have talked to you all separately about a number of these initiatives specifically and the impact that we're having. Commissioner Griffin mentioned Double Bucks, its reach, as well as the impact of it and we tell you how many servings that purchases a family of healthy food items. So it is a continuum, and we haven't operated in this kind of space previously. We've made a lot of investments. We've targeted seniors. We've targeted pregnant women. We have a lot of targeted initiatives, but there will come a time where we'll have to make more strategic decisions about what we invest in when we don't have, for example, an ARPA fund to be able to help fund building brand new grocery stores and new structures. And all we'll have is the mobile market. That'll be our answer, right? Or farmers markets or whatever micro initiatives we might be able to conceptualize. So I don't want you guys to get too bogged down in sort of the evaluation of what we're doing today and how to make funding decisions today, because that's not really the intention. We're trying to build a foundation of knowledge for us so that we can make those informed decisions on a go-forward basis.
Okay, I appreciate that. That does clear up a lot. Thank you. And I'm done.
Yeah, and that was Dr. Raynard Washington making those comments. Commissioner Powell.
Thank you. Thank you for your presentation and the work. On my screensaver on my computer, since I've been sworn in, is Dr. Gorman Brown. And for anyone that knows her, she worked in healthcare for her entire life. When we used to do discharge instructions on patients with kidney failure or diabetes or cardiac failure, it was almost like you felt like praying once they left the hospital because you wondered if they would have access to nutritious food, the food that they needed. And when I drive by the warehouse of where Carolina Farm Trust is, and I see what's around there, and the chronic illness around there, and I think about all this, what do they even have access to all of these things, affordable, nutritious? And so my focus, and food security is so important, but my focus, I'm really thinking through access to nutritious food, because as part of the presentation, you were saying we want to be proactive, not reactive. Well, we have to be reactive to all of the patients with chronic illness, but we also need to be proactive to, helping people become better decision makers on food choices. And so, when I really love what Commissioner Griffin's saying, because are we investing the money in the places making a big difference? I was at a farmer's market in Madison County where if you could use your double bucks to buy a t-shirt from a vendor. And that was not the intention of the dollars. So do we have access to information on how the SNAP double bucks are used or just the dollar amount?
Yes, we do.
So we have
infor-
access, it'll say what they purchased with it or the vendor they got it from?
Yes, we do have overarching information that gives us insights on what they're spending their monies on. We work closely with Carolina Farm Trust, Charlotte Mecklenburg Food Policy Council, who do some of those assessments, and they are able to get some of that data for us.
Thank you.
Commissioner Powell, there are restrictions though on what they can purchase, so they can't use it to buy certain types of goods. So they wouldn't be able to buy a t-shirt with double bucks.
But I'm telling you, that was there was conversation about that.
Yeah.
And so I'm not an expert in it, but it was troubling because I thought they should, because they were surrounded by vendors with fresh fruits and vegetables. And I thought they shouldn't be allowed to use the dollars for t-shirts. Anyway, hopefully they caught on to that and it's not possible anymore. But another story, like I was in the post office during COVID in a very long line in the post office and everyone was complaining about the post office. And then the conversation went to food security. It was where my district marries up to Commissioner Leake's district. And so there was a lady there and she said, you won't go hungry in Mecklenburg County. You just have to know where to go. And so she listed off all these places and we were there for a long time. So I was just listening to everything that she was saying. So you might not go hungry if you know where to go, but would it be nutritious food? And like some of the things that I see passed out are not like where you can go get food. It's not nutritious. So again, my focus is on nutrition security. And I really appreciate the mapping and the understanding of what we're facing because you can't really target your resources if you don't know. So I appreciate that. And I want to know more about any kind of partnership that we have with the healthcare giants. Like, you know, what kind of partnership do we have with Atrium and Novant right now?
Do you want to speak to food as
Yeah.
prescription?
At the moment, we're doing food as prescription programs with Atrium and Novant. And these programs are targeted for Atrium. It's at the moment our women's health clinics. Prior to that, it was a broader range of individuals at the Atrium clinics. With Novant Health, we are targeting our seniors. We wanted to ensure we had more equitable access in those two major clinics. Atrium, we've been doing the food as prescription for at least 3 years, and Novant, it just started this year.
Can you describe the food as prescription program?
Yes, a food as prescription is a process where we identify health care workers identify an individual who would be facing aspects of morbidity, and there's also an identification that food access is an issue for that individual. And so in addition to their health care, they would be aligned to sources that can give them healthier options for food. And so if it's a clinician, if it's a healthcare worker working with that individual, they would give them money. So they would give them a voucher for which they could purchase fresh fruits and vegetables. Now with food as prescription, it is limited to WIC approved fresh fruits and vegetables. And those can be purchased in select locations depending on the program that they're in. With Novant, the program, as I said, is for seniors, and so we're giving them $80. So they get $80 that can be spent on fresh fruits and vegetables, WIC approved, and it can be in 6 different stores, and it can also be used online. For Atrium Health, it was $40 for fresh fruits and vegetables, and that was limited to Food Lion.
Thank you.
Thank you. Commissioner Leake?
Thank you for your presentation. We've been working with this for the last 25 years, or maybe longer, as it relates to the total issue of food that's in different sections of the community. Where low-income families are, you have a food desert, and you have fast food restaurants that have multiplied in our community. These are basics. How do we keep those fast food, greasy businesses out of our community? I was with a group maybe 2 years ago, and they were putting in Popeyes into the community. Fast food grease, easy to get to. So how do we change that mentality of people thinking that because people are poor, they don't want to eat healthy? And I think about years ago when people lived on farms and walked a lot and they had better food than they have today. But we are in serious trouble when it comes to having issues adjusted to fast foods and other foods. My problem is, why is it that we cannot encourage Harris Teeter, the larger markets, to put small businesses into our community? If you look at these apartments that they just put downtown, every one of them have a small market within the confines of those apartment complexes. But yet they say they cannot come to our community because of the numbers. So then that's a form for me to say that that's a form of segregation. Make sure you stay in that area. Whom we work with, and especially with the school system, I'm not too sure about the food that our children are receiving, but at least they're getting something and not going without for 24 hours without food. I called several sites this last summer because they were changing people who were providing the foods. I'm not sure I'm getting it right, but parents called me about it. And that there was a major issue, but I never got a recall back from the school system or from the agency that was providing food for the schools for the summer. So I may be rambling, but I'm talking about the major problem of fast foods and non-markets within the confines of where people look like me live.
Thank you, Commissioner Lee. Any responses to any of Commissioner Lee's comments? If not, we're gonna go over to Commissioner Rodriguez McDowell. Any comment?
Well, I can start by saying there are some communities that are getting creative and innovative with policymaking to limit the density of fast food restaurants or how close they are to low-income communities. So there's definitely some things we can explore as potential innovative policymaking spaces to just explore that in the area.
Most of which would fall under the authority of the city, though, not the county.
Didn't hear you.
Most of which will fall under the rulemaking authority of the city in terms of zoning. The kinds of things they've done some cities have done to address density of food retailers in neighborhoods and communities.
Can't hear you, son.
As the types of innovative policy, Dr. Scott speaking to, a lot of that would fall under the scope of the city in terms of their zoning restrictions for fast food density in certain neighborhoods, but takes a lot of creativity and there is a lot of limitations. So we've taken the approach of really trying to infuse healthy options versus the enforcement approach where you would try to restrict unhealthy options.
Commissioner Rodriguez McDowell.
Thank you, Mr. Chairman. This conversation has been, great. People have already asked a lot of the questions that I had, but I was wondering, is there going to be a time where we can hear from our partners, Nourish Up and Carolina Farm Trust, or are they just here to listen?
I don't think they were on the schedule.
Okay.
Is
Is it okay if I yield my question to, if they have any questions?
No, ma'am.
Okay.
You're a guest too. All right.
Definitely understood.
Do you have a question? They'll probably say, give me more money. I'm sure of that. No disrespect. Mr. Rodriguez McDowell, did you have a question?
That was my question.
Oh, okay. All right. Commissioner Myers, we're gonna go another round. I don't know how far we'll get, but I think one more round. I think we.
Well, I'm going to take that segue because my questions are for the both of you, Nourish Up and Carolina Farm Trust. In the end, I just want to know if we're making a difference. So I know that's our goal, that we're making a difference. And so I will patiently wait however long this is going to take. But so when you're looking at these maps, as always, we see it's the crescent where everything's happening, the food deserts, et cetera. And so I know where Carolina Farm Trust and Nourish Up are located. Are there plans to have satellites of your organizations in the east? Because right now you're in the west. part of the city, of the county? Are there plans for that?
Well, we're evolving the urban farm in Aldersgate to have more infrastructure, which we're working on. I mean, that's a funding issue, Commissioner Griffin. We also just had a church that's right off Sharon Amity and Shamrock, which is very close, that is donating about an acre for us that we're going to figure out what to do. We're in the midst of talking to Charlotte Center City Partners around getting a pop-up market right off Trade and Tryon. And we also been talking with Mike Griffin and his group around Brook Hill. But we just been running into some zoning issues, just because that's the way that it's zoned versus what we want to do from a pop-up market standpoint. But that's kind of where the whole premise of our CFT market was, having that as a base, and then where we can have pop-up markets around the county. And then there also is funding in our phase two, the phase two of our project, to have multiple mobile units that we can kind of go out into the community, where we have direct routes, and they can just make that route, come back to the distribution facility, get stocked back up, and keep on going. And we're also in current with the USDA getting our EBT machines for the market itself that will actually have a mobile component to it. So we can take our FNS number, all around the county.
So I want to interject for Zach. Carolina Farm Trust supplies our CRCs, as well as our mobile markets out of services for adults. So there's already a mobile component to the work that Carolina Farm Trust is doing.
Thank you. And I would just add, I mean, our Hunger Hub it's in the middle of District 2, right off of Beatty's Ford Road, but we cover all of Mecklenburg County. I have 41 food pantries throughout Mecklenburg County, but as much as I would want to open a pantry on every corner, where we're seeing the most growth and the most demand for help is with our grocery home delivery program. Because, it was mentioned earlier about transit and the bus system and things like that. Well, we're providing a week's worth of groceries. So even if our pantry is on a bus line, that's difficult for somebody to carry a week's worth of groceries home. So our magic is, 20% of the people that we've served this year have been served through our grocery home delivery program, as opposed to one of the 41 emergency food pantries that we have. So I only want one Hunger Hub, but we will serve all of Mecklenburg County in every district, every corner of the county.
Well, thank you, and your work is invaluable, and I think this is what Commissioner Rodriguez Medal wanted to hear, some of the concrete things that we're doing, we're partnering with, and what you're doing, so thank you.
I want to interject, Retina, as well, because we have Nourish Up's locations in our community resource centers as well.
Yep.
So all individuals that come to those locations, they can access both Nourish Up and Carolina Farm Trust products.
Can I have one more question?
Sure.
About
I add
bus-
one other
Yeah,
thing
yeah.
too on that. Nourish Up also helps with produce for our mobile market location. So Carolina Farm Trust and Nourish Up and Second Harvest as well.
My next one is bus transportation. I know that's one of the part of the plan, directly to grocery stores. Are we working with the city yet on that?
Yes, we are working with the city on that. We are actually primarily targeting for now our Charlotte regional market. That's what the largest market we have in the county, and it doesn't have public transport access to it at all. And Derek, who's right here with us, that's one of the programs that he's working on, and he's been making quite good traction. We definitely need to be leveraging collaborations across, as I said, different county departments, and there would probably need to be more clear policies that we can come about that would help drive robust integration of our services. Those are things that we are not quite doing now. A lot of our programs are siloed. And so it is assessments like this that begin to highlight where some of those needs are. And I do want to underscore in all of this that food security is a wicked and complex problem. Wicked in that there's no one clear solution. So we can't assume that we're going to fix it all. Neither can we assume that the programs we are doing will have an immediate an immediate impact. Many of them are a little slow, take some time, and require collaborative efforts for it to be long-term and sustainable. And that's what we're doing. We collaborate with Tina and with Zach for the programs that they're doing, like Mr. Trotman said. And we are doing, beyond what they're doing, other work within the county to start to address some of those issues and chip away at the food security sector.
All right, Commissioner Powell.
Thank you. I think I just want to learn more about, like you said, there was so much work done in silos, and there's so many things where if the right voices are in the right room at the right time, better things can happen. And so I met with CATS last year to ask why we don't have bus stops in R.L. Smith Park and Eastway Rec Center, to why aren't the buses coming through so that to pick people up so they could ride the bus to the grocery store. And so when we're building our facilities, wherever they are, we should be thinking, how do we work with CATS to make sure that the bus will fit in, you know, be able to come and loop around and get in and pick people up? And how do we advocate for these bus stops? Because, I mean, to carry your groceries that far is very difficult, and some people can't even do it. So that's one thing. And I really want more information, and I'll go where I need to go. The healthcare giants, like I want to know what, I feel like that we should be doing significant work together.
I agree. The state applied and I believe was approved for 1115 waiver, and that allows for Medicaid to reimburse for food. And so the 5 standard managed care plans will be are contracting with the healthcare giants to set up a food as prescription program. We're just waiting for the state to move forward with the plan. It's called the Healthy Opportunities Waiver. And so this is something that we've been talking about for years. There was a pilot that was done during COVID. Then they moved for a statewide waiver. So all of the managed care plans should be reimbursing the hospitals and providers to do a food as prescription program, as Mamie talked about. I'm not sure what the dollar amount is going to be for each of those items, but that is the goal.
Thank you.
But as far as what they're doing themselves with their money, we have to invite them to this meeting to talk about that.
I would love that. Thank you.
Yes.
All right, Commissioner Leak, you get.
I'm still going back to why can't we have grocery stores in our community and got to ride the bus or a corner store? What's the problem that we can't have the same equities that other communities have? What's the problem?
I think.
Oh, sorry, I can't
I
see.
think Commissioner Leak, that's something that we're gonna have to do. The 9 of us, 5 of us, from a public policy perspective, to reach out to the corporate community, the grocery store community, because it's all politics. So, and we represent politics, so we need to take that initiative on with the support of staff to try to see what we can do for some of the people who may not be familiar with. Harris Teeter was on the corner of Beatty's-Ford Road and LaSalle Street at one time. So there's a lot of information historically that's available about what used to be. That's why I'm so concerned about the actual impact. But that's going to be a role for us, and maybe we can talk about that at the retreat, about what we can do to encourage some of those markets to come closer to the center city.
But thank you for those comments, but I still say, living in District 2, the community depends upon the workforce that we still have the fast foods. And you talk about politics, anything that we do is political. depending upon who's the strongest political advocate. And we found that out just a couple of Tuesdays ago. So maybe we can advertise. How do we get this same type of report, but digested some for all of us to understand the presentation for the community? This is wonderful material, but it's gonna sit on the table, okay? And it should not sit on the table. This should be disseminated within the confines of our community. Saying to the people, this is what we found, and this is what we are working to make happen within the confines of our community.
So that is what our next steps are. We just completed this report this month, and we are looking at ways that we can create simplified versions to communicate this information through creative channels to make sure that the community has access to this information. So it won't be this version of the report that we're disseminating throughout community, but definitely based on demographics and readability, understandability, different formats so that people can have access to information.
Thank you so much.
Thank you. And I'm going to wrap this up, colleagues. On your slide, says Phase 1 overview. It says significant investments have been made into the food security ecosystem since the last former county food assessment. There isn't unlimited money. So the question becomes how effective the resources that we are putting into the food ecosystem and what the impact is having. If someone, staff or nonprofits or whatever can say, what's the dollar figure to completely address food insecurity in Mecklenburg County, then let's backward map from there. Rather than just continuing to have program after program after program and year after year, people saying the same thing. In the Crescent, there's food insecurity. I even take what Commissioner Powell said, if there's such a thing as prescription for food, let's fix that. If people are sick coming out of the hospitals, we want to make sure that's fixed. We know that resources are available for anybody that's had surgery or whatever it is, and the doctors say you need fresh fruit or whatever it is, that's fixed. That's one population that will be fixed. And if there's another population, fine, but to continue to go down this road, I don't think it's going to have the effect that
Well, if I could,
us would hope we have.
well, just like to respond by saying that's exactly what we're hoping to solve for with this particular assessment. Moving towards having a system where we can understand the impact of those investments so that we can make stronger decisions moving forward. As mentioned, we know this is a complex issue, one we won't solve overnight, but we're hoping that this is the start to how we can start to at least have some consistent information that we have access to review that can help us determine whether or not the investments are viable and how we make decisions moving forward.
Thank you very much. I'm going to see if there's a motion that we can adjourn the Health and Human Services Commission.
So move, Mr.
Is there
Chairman.
a second?
Second.
Hey, all those in favor say aye.
Aye.
All right. Those opposed, same sign. Ayes have it. Thank you, ladies and gentlemen. Thank you for your attendance and your attention. Yeah.
They don't put them in our community.
I know, but we need to take some population.
Thanks, Taylor. You're welcome.
We can have that as a treat. If
Did you need,
60 was the population, then that's the population. If we can do more,
Well, the Crescent